Recording started. So welcome to webinar number 2 in our programme. So hopefully you can all see the screen there for APP 702, Advancing Research, Knowledge and Practice, with the little cartoon animals. I had a few issues with webinar links this last week, so I apologize that the webinar links were sent out only yesterday. But I thought what I'd do as I had them all, is I've now added them to the DLE. So if you click on webinar links there, it will open and you have the links for all of the webinars now for the rest of the module. If you can't click the link directly in this format, then you can cut and paste that link into your search bar. So that's all of the links now for the next webinars are all there. I'll probably send them out as a broadcast email before sessions as well, just to make sure you've all got them, but there are the links. Are there any questions or comments or things that you wanted to mention before I start from a fortnight ago? Give you the opportunity to have a little think if there were any questions. Or was there anything particular that you wanted me to revisit or go over again from the last session? Okay, so nothing coming to mind initially. A number of you have sent me emails, in fact quite a few of you have sent me emails asking for some guidance around subject areas. I will address all of your emails individually, but one of the biggest questions was around topic area. So firstly, yes, once you have a topic area, if you want to ask me if it's okay, then that's fine. I'm happy to say yay or nay. One of the questions, well, not one of the questions, I think I've had about 14 or 15 emails asking pretty much the similar question, i.e., is this topic okay? So, as I said, I will address all of the emails individually, but what I wanted to say in terms of general commentary about topics is, if you come across a topic and there's something that triggers your interest that you want to do for this assignment, and you do some initial searching on that topic area and find nothing, or find 2 articles that are old, or 3 or 4 articles that are pretty iffy in terms of method and methodology, then I would suggest that you either adapt your topic or broaden your search terms. If you can't write a narrative review on 2 articles, 3 articles. So if there is nothing or very little written about your particular subject area because it is so narrowly defined, then I would advise against it. It's just you're making your life more difficult than you have to. So start thinking more generically. So if it is you want to look in temperature control in neonates, for example, then specifically in pre-hospital care, then maybe one of the parameters you might exclude initially is the pre-hospital care, and maybe look at neonatal temperature management broadly. Or if you wanted to look at attitudes towards a particular treatment in genetics or genetic counselling, then again you might want to broaden that topic. So hopefully that helps some of you think about your topic area, don't make your life more difficult. So as I said, if you're coming up with a pre-May search and you're coming up with a limited amount of information, then maybe broaden your search terms more in terms of search terms specifically, or in terms of age of research, or in terms of international and so on. If you're still coming up with very little, then I suggest that you think of a different or slightly different topic. In terms of the progression from this module on to the next and to the next and to the next, so the 3 modules sit as a sort of group. So there's this module, Advancing Research Knowledge in Practice 1, and then 2, and I touched on this a little bit last time, but these modules are designed to build together towards your dissertation module. So you write the narrative review for this time, you then write a research proposal for the next one, which adapts your narrative review into a background analysis of your study and develops a research proposal, and then it takes it forward to your dissertation. Questions around the dissertation module, I've had a number of emails about that in the last couple of weeks as well. Again, I will address those in the next day or so, specifically around ethics and timeframes. So if you've asked me a question along those lines, I will get back to you. Excuse me. So, are there any other questions regarding the topic or the selection of topic for your narrative review? With a brief show of hands, have some of you already selected your topic or have an idea of topic or topics? If you have, put your hands up. Okay, so pretty good show of hands there, which is great. So most of you have got an idea or a rough idea, and even if you haven't got it fully defined yet, you've got something to start in terms of searching and reading around your topic area, which is great. It never ceases, well, it takes longer than you think, so please don't leave it to the end, sort of after Christmas to actually start your literature searching, because it does take longer than you think it will. In terms of EndNote, I will put the link to the EndNote information that I shared with you last time on the DLE, if it's not there already. I think it already is, but I will check. And there's lots of tutorial information about how to use EndNote and what to do with EndNote while you're searching for an article and while you're reading an article. So I will put that information on the DLE. Any other questions around topic? Okay, so hopefully we're starting to think about the topic, starting to do a bit of reading, starting to refine our searches and so on, and find some research. And in a fortnight's time, you've got Rona doing critical appraisal of the literature. So certainly my recommendation to you by then is to certainly have some research already read and looked at, so that you've got some examples to work through when she's talking about critical appraisal of the literature. Sorry, a question's come through. Yes, you can reference any kind of multimedia, whether it's YouTube or anything. Certainly in terms of EndNote, there is there is a way of referencing media, and the guidelines are on the website. Breakdown in terms of the narrative review. Yes, I can point you towards the actual assessment guidelines, which are on the welcome and module information tile under the tent. And if I highlight to you this document here, which is assessment guidelines, there's the specific breakdown of the assignment, what's to be included in each section and what marks are allocated to each section. And we went through that last time. So if you weren't with us last time, then have a listen through the recording of the last session, because I went through it in some detail, and the assessment guidelines are there. So, any other questions? One of the benefits, I suppose, of doing it via webinar is that everything I say is recorded, so you can always go back and listen to it again. Okay, so if there's no other questions, I will move forward with the focus of today's session, which is the qualitative research. So this session was uploaded to the DLE last week sometime, so it's there for reference, but our focus of our attention today is going to be about qualitative research methodology. So just to recap what we were talking about a fortnight ago about what is a paradigm. So we're talking about paradigms of research here. We're talking about, we either talk about the quantitative paradigm or we talk about the qualitative paradigm. So we can talk about the positivist view or the interpretive or humanistic view. So these are two different, very different types of research, and hopefully you've already highlighted some research and you've already been reading some pieces of primary research that you've collected in your particular subject areas. But hopefully you've been able to identify from what you've been reading whether it is a qualitative piece or a quantitative piece. So if it's a quantitative piece, it's deductive, it's often tested a hypothesis, whereas if it's a qualitative piece, it's inductive. And it's not there to test or prove anything, it's simply there to advance theory. I say the word simply there, maybe I shouldn't use that word. It's there to advance theory. So just to recap, quantitative research is often about numbers. Don't get sort of blinded by the fact that there's numbers there, because both paradigms can use some numerical information. But quantitative research is often looking for cause, it's looking to explain something, and there's a level of objectivity. Whereas qualitative research is very much about seeking to understand, seeking for reasons of rationale, and there can be an element of subjectivity to it. So the focus of our session this afternoon is not on the deductive, the positivist view, it's on the inductive, interpretive view. So we're going to be talking about qualitative research this afternoon. So what is qualitative research? Hopefully you can all identify, can think of an example. Maybe you've read something recently, or you have a piece of research in mind that is qualitative. So it's an approach to research methodology. It usually involves research in the field, and it's usually, if not always, complex. So why would you choose to use qualitative methodologies rather than quantitative methodologies? Because you're asking completely different questions. You're asking, you are seeking to inquire in a completely different way. So you're often trying to develop a theory. You're not testing it, you're not proving it, you're developing it. You could often be seeking to understand something. So why people behave in a certain way. So trying to understand a phenomenon. You might describe the nature of a phenomenon. to verify something in its real world setting. So often we talk about realistic research, pragmatic research, where it might work one way in the lab in a deductive manner, but let's put it in its real life setting and see if it happens the same. And we might also seek to evaluate a practice or an approach. And often in healthcare, we're often looking to evaluate something in the real life setting, in the real world. In quantitative research, we might look at how a drug reacts, for example, in the lab. We might look at how a drug works on a white rat and have hundreds of white rats and hundreds of drugs, and we might look at it in a very objective way. Whereas if we wanted to test how it feels to have this particular drug, we might want to do it in a real life setting. Now, I know some of you are going to think, oh, well, what about randomized controlled trials? Well, again, that it's a different methodology. You're seeking to find a cause and effect. You're not seeking to verify something or understand something or describe something. So it depends on the approach as to what question we're asking. So there is a huge value to qualitative research because it's asking completely different questions. So if we apply this to you and yourselves, what kind of questions do you have that might fit this criteria? So if you were thinking to yourself about doing a piece of qualitative research, or you've read a piece of qualitative research, what sort of questions were they asking? Can we think of any examples of research that we've read recently, or something that we might want to investigate that could fit a qualitative paradigm? Okay, we're coming up with some very interesting statements there. So yes, if we're looking at how people perceive something, or how they feel about something, or what their reaction or what their experiences of a particular issue are, then yes, we're absolutely asking qualitative questions. So we've had some excellent examples, such as people's feelings, people's perceptions, and people's understanding of information. We've also got some interesting alternatives. So people have come up with some other suggestions. There's one here which is a better secondary conduit, an arterial radial artery or a saphenous vein? Which is better is the key phrase I want to focus on. If we're suggesting that we want to prove one is more effective or better, which is a odd, not odd word, it's a difficult word to discuss, then we're looking at it from a much more positivist perspective, because that sort of question is very much asking a positivist question. If we change that question and said from the patient's perspective, which is more effective, then we might be turning it into a qualitative question. If we're looking at a patient satisfaction survey, that tends again to be measuring satisfaction and using quantitative data or numerical data to prove, again, I'm using that word prove, that patients are more satisfied or less satisfied with a service. So both those examples lend themselves much more to a positivist paradigm rather than an interpretive paradigm. So we have to be very aware of what sort of questions we're asking and what the aim of our inquiry is. So if we're seeking to prove something is better than one thing is better than another, or one intervention is better than another, then we are tending to use a quantitative approach. If we're seeking to inquire or advance our understanding of something, then we're using a qualitative example. So, really interesting set of statements, but I wouldn't say all of them followed the qualitative paradigm. Any questions on that? Any questions? So as it says there, a qualitative research usually begins, and I say usually, it doesn't always, but usually begins, with a very general question. So a general broad inquiry which describes or seeks to interpret a phenomena. So what are you describing? What are you interpreting? What are you trying to seek a better understanding of? Seek a better understanding of, rather than prove one thing is more effective than another, or one thing is we are more satisfied or less satisfied with a service. So it's about seeking to describe, seeking to interpret, and not measuring from a factual perspective. So again, how is this different from quantitative research? So often it's easier to think about how it is different rather than think of it on its own. So there's no null hypothesis. And that a null hypothesis or a hypothesis is a statement that we wish to prove. So a null hypothesis is the negative statement. So if I wanted to prove that one thing was better than the other, I might make a null hypothesis of this treatment is the same as this treatment A is the same as treatment B in terms of patient outcome. Prove or disprove. So yes, you're either seeking to confirm or refute, disprove a hypothesis. And yes, that's the aim of a quantitative piece of research, would be to either prove or disprove a hypothesis. You're trying to establish a causal relationship, and you're therefore trying to establish that there is a level of confidence that you have in a particular statement. So that's when we talk about confidence intervals. So this is more likely than not, probability statements and such like. So that sort of language, if that sort of language is appearing in the research title or in the research question or in the research that you're reading, then you then think to yourself, actually this comes from a positivist paradigm and not an interpretive paradigm. So quantitative and qualitative research methods differ primarily in their analytical objectives, the type of questions that they pose, the type of data collection instruments they use, the form of data they produce, and the degree of flexibility built into the study design. So there's key differences. So if we unpick some of those statements, the type of questions that you pose, which goes back to a couple of slides ago when I asked you to ask a qualitative or quantitative question. So it's very much about what is the question that you're asking? What are you seeking to find out? Or if you're reading the research itself, what is this research trying to do here? What is it trying to find out? There'll often be differences in the data collection instrument. So whether it's an experiment or whether it's a survey versus whether it's a set of reflective diaries, an interview, a focus group, and so on. So different data collections methods are used. And therefore, the data that is produced is different. Is it numerical data? Is it measurements? Is it observational experiments? Or is it narrations, stories, transcripts of interviews and such? So very different types of data that we'll be analysing. And going back to the degree of flexibility, if we're using deductive methods, then we tend to have a very fixed, objective stance. So remember the words that I used a fortnight ago about ontology and epistemology, where we are in terms of the research question itself, and the flexibility that's built into the study design. So sometimes we talk about inductive methods where the data that we're collecting guides the way that we collect it. So if we are doing a series of interviews, our interview schedule may change and adapt to follow the theoretical threads that are unfolding in the research that we're collecting. So when you're reading some qualitative research, you don't often see an interview schedule in publications, but sometimes they will include them. But usually it gives you examples of the rich text that's been produced from the interviews. So you'll see a series of quotes, and there tends to be a level of flexibility in that data. So when you're reading qualitative research, you'll often see very different forms of data being presented to you. Core activities in a piece of qualitative research are pretty much the same as they are in terms of a quantitative research. So the studies that you read should have a literature review to start. They should make some sort of indication as to the ontology and epistemology of the researcher themselves. So putting that researcher in context, exploring the researcher's beliefs, because they are part of the qualitative research. The role of the participants, subjects or informants. So how did they become involved? How were they sampled? So a quantitative research piece might talk about randomized sampling, and it might talk about inclusion and exclusion criteria, whereas a participant selection might be much more inductive, and it might be much more flexible. So they might talk about convenience sampling or purposive sampling. They might put the data collection in context. So how was it collected? Where was it collected? Why was it collected in this manner? Some rationale for data collection choices, and then the data analysis that's been presented to you in your articles. And they might talk about saturation. So they won't necessarily say from the outset we decided to interview 20 people. It might say something along the aims of the study were to interview 10 to 12 or 15 to 20. They don't tend to give specific numbers because you stop interviewing people when you've reached theoretical saturation. So the core activities are similar, but they do differ slightly from that of a quantitative piece. Any questions? Okay, so in terms of a literature review, and every piece of research that you read, they don't necessarily all call them a literature review. Sometimes they call them background to study or background, but there should always be some literature in terms of the context. One thing that differs slightly between a qualitative and a quantitative piece is the literature review can happen during data collection rather than simply always happening before. So we might have constant comparative methods and constant comparative analysis going on with the literature. The rationale for delaying the literature is to avoid leading the participants in the direction of what is already been discovered. So you don't want to completely colour what you think about an issue by reading what everybody else thinks about an issue. There's a bit of a chicken and egg situation there, though, unfortunately. When you come to do a piece of research, if you go on to the dissertation stage, you will have to have done your literature review first because it forms part of different assignments, i.e. this one and the next one. And so there is already a literature review having occurred. But if you read research, qualitative research, then sometimes they say that the literature review was undertaken concurrently. And the purpose of the literature review, as we talked about last time, is very much to show what is known about a particular field, because the aim of qualitative research is often to advance theory, so you need to know what's known already so that you can ensure that you're advancing thinking. And to see whether what you're inquiring about fits in to what's already known. When reading pieces of qualitative research, it's often evident how the piece fits in with what's already been published. One of the phrases we often use in qualitative research is about bracketing. So a piece of qualitative research might discuss how the researcher's beliefs or biases or personal views on a particular topic might be set aside. And that's sort of slightly a theoretical idea, because you never really completely set aside your ideas. But the investigator or the researcher should make some attempt to highlight what they think about a particular issue, and then say how what they found out since may have added to, changed views, or built on views, and so on. So it's about the investigator being honest about what they think about a particular area, so that they can be made aware of how they interpret the data and how that might affect the way they analyse and the way they ask questions. So if we think of that in real terms, if I want to find out how people feel about a particular practice, a group of professionals, so for example, I was talking to advanced nurse practitioners and I myself am an advanced nurse practitioner, my thoughts about my role are going to influence the questions that I ask people about what they think about their role. So I have to very carefully make sure that I'm not asking leading questions to prove, although I'm not seeking to prove something, that I'm not seeking to build on what I know or feel about a particular issue. I'm actually trying to find some honest opinion. So we talk about bracketing and collecting those views and sort of putting them aside. Obviously, I can appreciate that that has its problems. Subjects or informants. The questions come through about bracketing. The Hawthorne effect is very much about people behaving differently because they know they're being researched. So I'm not sure if I've shared this example before. If you went onto a ward and said to the ward, I'm going to watch the way I'm here to evaluate hand washing, you would expect that everybody on the ward would undertake the technique of hand washing correctly because they know they're being watched. So your behaviour changes because you're being observed. That's what we talk about when we talk about the Hawthorne effect. Bracketing is slightly different because we're we're collecting our views and saying, I know what I think about this particular issue, but I'm trying to put that aside and find out what everybody else thinks about this particular issue. So hopefully that answers your question. I haven't got a yes or a no, so I don't know whether I have. Hopefully I have. I'm not sure I understand. So not disclosing information. I'm not sure I understand what you mean. So to recap, the Hawthorne effect is when you change, or the subject of research changes their behaviour because they know they're being researched. So using a different example, if all of you, if any of you can remember learning to drive, you all had your hands at 10 to 2, didn't you? 10 to 2. So hands on the steering wheel, both hands on the steering wheel at all time, because you know you're being watched. Your driving test, if you remember this far back for some of you, or if you've even taken your driving test, I don't know. But in your driving test, you have your hands on the steering wheel at all times. You mirror signal manoeuvre, you put your hand on the gear stick, you change gear straight back onto 10 to 2, 10 to 2 all the time because you're being observed. And as soon as you stop your driving test and he gives you your certificate to say you've passed your driving test, then you've got one hand on the wheel and the other one's, scratching your head and playing with the stereo or whatever. You don't have to behave in that way anymore because you're not being watched, you're not being assessed. So all of you can remember examples of when you've been assessed and been observed doing something. You change the way you're doing it. If any of you have got young children, when you're showing them how to chop something, you do it in a specific way in the kitchen, whereas if you're doing it on your own and you're not being observed, you might be slightly less systematic about it. So that's the Hawthorne effect, and quantitative researchers and observational researchers talk about the Hawthorne effect quite a lot because it's something that they've got to take into account when they're observing people. Now, you can't not tell somebody that you're researching them because that would be unethical. So you can't go and covertly observe people. You need to get permission. But what you can do is, if you're doing a piece of research and you need to find out what people think about a particular issue. So if I wanted to canvass your opinion on, I'm just trying to think of an example. What could I canvass your opinion on? Marks and Spencer's sandwiches. Specifically, Marks and Spencer's sandwiches in X shop on Y day. If I absolutely love Marks and Spencer's sandwiches. So how do you feel about Marks and Spencer's sandwiches? I've told you, I've confessed what I think of them. Is that going to colour your judgment? Is that going to temper the way you respond to that question? It's a slightly trite example, but if I've told you or made it clear what I think about an issue, then it's going to influence, whether it's conscious or not, the way you think about a particular issue. So if I am doing a piece of qualitative research and I want to bracket my own feelings, then I need to ensure that in the questions that I ask and the way that I ask them, I don't make it obvious to you as the researchee, the participant or the subject, that you know what I'm thinking. So it's not necessarily about disclosing information, because I've told you about the research and I've told you about because I've had to give you information so that you'll participate, because that's ethical behaviour, but I haven't told you what I think about a particular issue. Does that answer your question? Okay, great. And in qualitative research, it's really, really important that although the researcher's beliefs might be, when you read a piece of research, they might be presented quite obviously. Hopefully they've made it clear that they didn't make those feelings available and obvious to the people that they were inquiring about. So when we're talking about our subjects or our informants, we tend to talk about them in terms of qualitative research. They're often referred to as participants or informants, not subjects. And that just really gives you a clear indication of where I've positioned myself as a researcher. So that whole inductive humanistic approach versus the deductive objective approach, that these people are viewed as participants in the research. They're there to inform, not something to be studied at a distance. Because I'm often, as a qualitative researcher, seeking to understand people's views, whether it's their cultural knowledge about a particular issue, through discussion, through involvement, so through participant observation, through focus groups, through interview, through questionnaire. I'm trying to seek their involvement so that I can elicit information about a particular subject to inform my theoretical perspective. So it's a completely different relationship with the people that are participating in the research. And again, the way I select my participants in qualitative research is going to be completely different. There's no randomized sampling or anything like that. We often talk about purposive sampling. These are people I have picked on purpose. If I want to find out about what it's like to be in medical school, for example, then the best people to talk to are people at medical school, which seems common sense, doesn't it? But it's about setting your stall out there. If I want to know what it feels like to be under 30 and have a diagnosis of breast cancer, then I need to ask women who are under 30 who've got breast cancer, and men. But if my particular subject is about women, then I need to ask women. So you establish clear criteria, but you might often see in the research that you're reading, they talk about criteria and rationale for selection rather than inclusion and exclusion criteria. Inclusion and exclusion criteria tends to be the language of the quantitative researcher. Our goal is not to prove anything, so we're not looking for generalization, we're looking at rich description. So we need to find people who have experienced the thing that we want to research. So the setting for our data collection is informant-driven rather than theoretically driven. Investigators assume ignorance of the culture or beliefs being studied. So that, again, it's about our bracketing. And informants teach the investigator. So I might seek to inquire how it feels to X. The data is collected in the field, not necessarily in. If I want to find out what it feels like to be an inpatient in on intensive care unit, for example, I don't have to actually physically be in the intensive care unit, but I need to speak to somebody who has been. So where people live and experience what their experience is. And if I'm doing some sort of observational work, then I have to ensure that I'm not being non-obtrusive, and I need to spend significant time in that field. If I am doing a piece of participant research or non-participant research, I need to be, again, aware of the Hawthorne effect, which we've already talked about, so that if you're there for a long period of time, people get used to you, and then they hopefully revert to normal behaviour. And it says there some researchers use multiple methods. So the research that you're reading, if it's qualitative, it might have used focus group and an interview, observation and a questionnaire, or focus group and a questionnaire. So a combination of methodological and a combination of methods to improve the holistic picture that we're getting of a particular phenomenon. So we can use multiple methods, but not multiple methodologies. And that's a really important distinction to make. So going back to the session that we had a fortnight ago, understanding very, very clearly what the difference between methodology and method are. Data analysis. Hello, I think I've lost audio. Can you all still hear me? Hands up if you can still hear me. Hello? Can you put your hands up if you can hear me? Hello, can you hear me? I have... Anybody put their hands up? Hello? I think we've lost sound. Hello? Can any... Hello? Anybody put their hands up? Can we see if we can re-establish sound? I'm not sure. Hello, can you hear me? I've got no audio. Hello? Hello, can you hear me, anybody? Hands up if you can hear me. Anybody hear me? I seem to have lost sound for some reason. Let's see. Hello? I'm wondering whether anybody can hear me out there in. I think we've lost our broadcast. I don't know why. Oh no.